Dear students, welcome back. In the previous session, we have discussed about hip joint musculature, that is flexors, and the remaining hip joint musculature, that is adductors, extensors, and the lateral and medial rotators in this part. So now we will move on to the adductors of the hip joint. The hip joint adductor muscle group is generally considered to include the pectineus muscle, okay, the pectineus, and next is the adductor brevis, okay, adductor brevis, adductor longus, and adductor magnus, okay. And also gracilis also comes under this group. So these are the five muscles, that is pectineus, adductor brevis, adductor longus, gracilis, and adductor magnus, which helps in adduction at the hip joint. The adductors are located anteromedially. The adductor longus, brevis, and magnus muscles arise in a group from the body of the pubis, body and inferior ramus of the pubis, to insert along the linea aspera of the femur. Okay, the gracilis muscle is the only two joint muscle which acts as an adductor. It originates on the symphysis pubis and inserts on the medial surface of the shaft of the tibia. Okay, so the contribution of the adductor muscles to hip joint function has been debated for many years. Okay, so after all these debates and all, and finally they concluded that in the normal hip in standing, the adductor brevis, adductor longus, okay, adductor brevis, adductor longus, pectineus, and posterior adductor magnus muscles had only small moment arms for medial rotation, whereas the gracilis and anterior magnus muscles had small moment arms for lateral rotation. With excessive femoral anteversion, the moment arms of the adductor brevis, pectineus, and the middle adductor magnus muscles switched from medial rotation to lateral rotational lines of pull. Okay, after examining the changes in the moment arms with femoral anteversion or combined hip medial rotation and knee flexion, the investigators concluded that the adductors were unlikely to have a strong influence on the medially rotated hip position during the gait cycle. Okay, but here we have to consider, so all these adductors will have some function in the medial rotation and the lateral rotation, and also the activity of the group of muscles we cannot ignore. However, since there are enough muscles that the maximum isometric torque of adduction, which is greater than that of the abduction, is seen by these muscles. So these muscles considered as adductors. Okay, and such kind of combination of actions of these muscles, because of their location and their action lines, which also have some function in the rotational activities. So this is all about the adductors. Now we will move on to the extensors. Okay, so in the extensors, the one joint gluteus maximus muscle, okay, the gluteus maximus muscle, and two joint hamstring muscles group or the primary hip joint extensors. That means gluteus maximus and the hamstrings or the primary hip joint extensors. These muscles may receive assistance from the posterior fibers of the gluteus medius and the superior fibers of the adductor magnus and from the piriformis muscle. Okay, but so they are taking help, that means they are secondary muscles, but the main muscles are gluteus maximus muscles and hamstrings. The hamstring muscles will include from medial to lateral semimembranosus, semitendinosus and the biceps femoris. The gluteus maximus is a large quadrangular muscle that originates from the sacrum, dorsoiliac ligaments, sacrotuberous ligaments and a small portion of the ilium, and it is the most superior fibers which insert into the iliotibial band. The inferior fibers insert into the gluteal tuberosity. The gluteus maximus is a strong hip extensor that appears to be active primarily against a resistance greater than the weight of the limb. Its momentum is considerably longer than that of either of the hamstrings or adductor magnus muscles. So because this is the most superficial muscle, if you see from the joint axis, so the momentum is definitely larger for this gluteus maximus muscle than the hamstrings, because the hamstrings are originating from the ischial tuberosity. So definitely these muscles will have less momentum when compared to the gluteus maximus. Okay. The maximus is also a lateral rotator of the femur, but may reverse this function in extreme range of motion. Okay, once the extreme range of extension is reached, then the function of this gluteus maximus may be a medial rotator. Okay, so next the two joint muscles, that is hamstring muscles. All these muscles originate on the ischial tuberosity. The biceps femoris crosses the posterior femur to insert into the head of the fibula. So this is the lateral most muscle. So it is inserting into the fibula. So the other two hamstrings insert on the medial aspect of the tibia. Okay, all three muscles extend the hip with or without resistance and flex the knee. Although the momentum of the combined hamstrings at the hip is less than that of gluteus maximus at all the points in the range. So the hamstrings increase their momentum as the hip flexes to 35 degrees and decreases it thereafter. So the momentum of the maximus decreases with any hip flexion beyond neutral. Okay, so this is a change in the momentum increase in the hamstring muscles than the gluteus maximus is when the hip is flexed to 35 degrees, then the momentum of hamstrings is more than that of the gluteus maximus. So if the hip is in neutral position, definitely the gluteus maximus momentum is greater than the hamstrings. If the hip flexion beyond neutral position, then there may be a decrease of momentum for the gluteus maximus and increase of momentum for the hamstrings. Okay, so the biceps femoris laterally rotates the knee and the long head laterally rotates the hip. Okay, the other two hamstrings helps in medial rotation of the knee. So this is all about the extensors. Now we will move on to the abductors. So if you see the abductors, so the main muscles which involves in abduction are the active abduction of the hip is brought about by mainly the gluteus medius muscle and the gluteus minimus muscles. The superior fibers of the gluteus maximus, superior fibers of the gluteus maximus as well as the sartorius may assist when the hip is abducted against strong resistance. So these two muscles, what are the muscles? Secondary muscles which helps in abduction against strong resistance or the superior fibers of gluteus maximus and sartorius. These two muscles will come into action when the resistance is applied during hip abduction. Okay. And already mentioned that the tensor fascia lata may be an effective abductor only during simultaneous hip flexion. The gluteus medius lies deep to the gluteus maximus. It originates on the lateral surface of the wing of the ilium and which is getting inserted into the greater trochanter. So the gluteus medius will have anterior, middle and posterior parts same as that of deltoid in the glenohumeral joint. Here the anterior fibers of the gluteus medius are active in the hip flexion and the medial rotation, whereas the posterior fibers of the gluteus medius are active during extension and lateral rotation. Okay. The remaining all portions of the muscle will help in abduction. Okay. The trochanteric bursa of the gluteus medius separates the distal tendon of the muscle from the trochanter over which this muscle will slide. The tendon is slide. Okay. So in some conditions this bursae may become inflamed and it is a source of pain here. Okay, now we will move on to the gluteus minimus. This gluteus minimus muscle lies deep to the gluteus medius, which is arising from the outer surface of the ilium and from the margin of the greater sciatic notch. The muscle fibers converge on an aponeurosis that ends in a tendon on the greater trochanter. Okay, the trochanteric bursa of the gluteus minimus allows the tendon to slide over the trochanter. The gluteus minimus and medius muscle function together to either abduct the femur in an open kinematic chain or more importantly to stabilize the pelvis. Okay, in unilateral stance, that means single limb support, in unilateral stance against the effects of gravity. Okay, so these are the major functions of these muscles. Okay, and the gluteus medius and minimus muscle either prevent or minimize adduction of the pelvis around the stance hip, that means pelvic drop. Okay, physiologically designed to work at the neutral or slightly adducted hip, the hip abductors generate an isometric torque that is 82% greater in neutral position than when muscle is shortened to 25 degrees of abduction. The concentric maximum torque generated by the hip abductors is also greater in the lengthened position of the slight adduction. Okay, so these are the main functions of these abductors. Okay, now we will move on to the rotators. So here we will find the major functions seen by the lateral rotators. Okay, there are no such specific muscles or primary muscles for medial rotators. Okay, so here for lateral rotation, 6 short muscles have lateral rotation as a primary function. So these muscles are the obturator internus and externus, the gemellus superior and inferior, and quadratus femoris and piriformis muscles. So if you see, all these muscles are present below this gluteus maximus muscle, and these are present on the posterior aspect. Okay, and these muscles, because of their anatomical position, they help in lateral rotation, and also the action lines which are produced by these muscles helps in excellent joint compressors. Okay, yes, this is the major function of these lateral rotators. Okay, so this is all about the functions of this hip musculature around the hip joint. In the next session, we are going to discuss about the muscle function in stance, which includes bilateral stance, unilateral stance, and also reduction of muscle forces in unilateral stance. Okay, so all these comes under this muscle function in stance. Thank you.